Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hello everybody, welcome to episode 88 of the Hair Loss Show. I'm Dr. Russell Knudsen.
I'm Dr. Vikram Jayaprakash. Thanks again for watching. Please remember to like and subscribe to the channel, and thanks again for all your feedback. We've found it very useful.
All right, so today's topic is about the usefulness of minoxidil in the post-hair transplant time zone. So the theory behind using minoxidil in this scenario is that it's because minoxidil is a hair stimulant, that two things can happen. One is that you can encourage the hairs in the grafts themselves to continue growing so that you get an immediate growth rather than some of the post-operative shedding that we see in some of the grafted hairs. So that's one aspect of it. And the other aspect of it is that if you're operating in amongst existing native hairs, treating the area with minoxidil might help protect them against the disturbance of the surgery, which can cause temporary shedding of the native hairs in the area. And this is something that's been of a particular concern for many years in treating our women.
So essentially, let's go back to basics. A hair transplant is moving hair from one part of the scalp to another. And so we know that those hairs or grafts will grow, and they grow well, but it doesn't happen overnight. So you don't have a hair transplant today and you've got a full head of hair by the weekend. So there's a long process, there's a long tail, so to speak, and there's a gradual regrowth. So where minoxidil will play a benefit is potentially shortening that timeline to getting to the end point. But in terms of the graft that you transplant, all right, and that as a single entity, do you think it changes anything in the outcome for that?
I think the answer probably is that once upon a time it might have, but probably not so much these days. And the reason is that the grafts are smaller and more sophisticated than they were before. Number two, most of the modern, really on the international world leading edge, are using implantation devices now, which protects the grafts during the implantation. So there's less graft handling with forceps than there has been in the past. And certainly there's a general consensus around the world that when you move to implanters and you load the graft into the implanter and inject it or slide it into the pre-made slit, that you are being more protective of the graft, there's less trauma to the graft, and so the immediate growth rate, which is how many of the hairs in the grafts just continue to grow straight away, has improved, which tells you that there is less post-operative shedding. So if we're talking about the grafted hairs, I think the minoxidil really doesn't make much of a difference. If we're talking about surrounding hairs, potentially it does.
I think the use of implanters is certainly beneficial, but also what's changed over the last 10-15 years is the mechanics of it, the holding solutions, and how we know more about the science behind how a graft is stored. It should be stored at a certain temperature, pH, and in the right holding solution. So I think the combination of everything means that probably the effect of the minoxidil may be not as prominent as it would have been.
And the only other caution I'd make about using minoxidil just in the perioperative phase is that we know that a percentage of our patients are going to have a shed.
Yes.
As a response to the minoxidil. Now, patients generally think that shed means that it's a bad thing, whereas we believe it's a good thing, because if minoxidil's working, it's stimulating a hair follicle to produce new hair, which is pushing out an old hair. So we get this phase in some of our patients where 4, 5, 6 weeks after we start the minoxidil, they get this increased shed, which is a temporary phase. But it's not a bad thing, it's a good thing, it means it's working. And so again, if you haven't been using minoxidil in the preoperative period for any significant length of time, it may not be in your interest to start it right at the time of the operation or post-operative, and then be that person who gets that shed, which would be a panic.
And this is the other thing that that also plays on my mind a little bit and concerns me a little bit is that person who's using minoxidil in that periodic phase for the first time, because we also know that 30% do get some sort of reaction to the liquid.
Right.
Now, that sort of inflammatory response, what effect? I mean, I don't know. Do you? What effect does that have on the graft in the short term?
Yeah. Okay.
There's always that concern.
Interestingly, when I did a survey of my colleagues about their use of minoxidil post-operatively, there are those who believe that you can just use it straight away.
Yeah.
There are those, like myself, who suggest we wait 48 hours.
Yeah.
The reason being I want the skin to seal before I put 70% alcohol, which is what, and 20% propylene glycol on an open wound. And therefore on the graft, if it seeps down to the graft. So I tend to want to wait 48 hours, but there's no universal agreement on this. There's no evidence that if you do it 1 day after versus 2 days after versus other people who wait a week, there's no evidence that I've seen that suggests it makes any difference to the outcome. So I think it's like the surgeon's individual preference that determines what their post-operative.
I think so. I actually generally, I know you said 48 hours. I just generally say 5 days to a week, not because of I have a scientific opinion about it. I just let them say, don't touch the grass for 5 days, don't do anything. And It's that's a blanket statement across the board. Because I can't imagine it makes a massive difference in that sort of.
So I think the real answer is there is no answer.
Yeah. But you can absolutely use minoxidil post-hair transplant. There's a potential benefit there in terms of the speed, but not necessarily in the.
If you're going to use it long term, I think that makes sense. But I'm not sure just using it short term makes a lot of sense.
Great, I think that answers that.
Excellent.
As much as we can.
Thank you again for watching, and keep asking questions and giving us feedback, because we would like to be able to respond to the questions of our audience. And we look forward to seeing you next time.
Thanks very much. See ya.